Let's have a Q&A session. There's a few questions that have come through. Do you have the Q&A doc handy, or you want me to share? You got that? Scroll down. I'm not sure whether I think we finished 15, or you double check. Maybe Dr. Fong. Or maybe
17. Dr. Bassi says, my orthodontist is afraid of expansion. Teaches at local university, reviews literature with students concerning is moving the roots out of the sockets, how to handle. Well, I've given you a lot of research that you can hand over to him to have a read on. Because we can't argue at the point. We have to show the evidence. So show the randomized control trials, show the 40-year perspective studies at major teaching universities. So he's a lecturer, right? So show him what the heads of departments are advocating and say, oh, are heads of department like higher ranking than lecturers? And is 4 decades of research more than your experience? Seems like these cases will take longer chair time, doctor time than other conventional ortho fixed bracket liners. Absolutely. Absolutely. Am I undercharging? Absolutely. But my appointments are 10 minutes long. All right, your appointments are 45 minutes long and you run 30 minutes late. Yeah, my appointments are 10 minutes. And I see 2 people simultaneously in each room. So it's like everything else. How long does it take you to cut a crown? How long did you book in your first year out? How long do you take now? It's an experience. You're going to lose money at the beginning. That's just life. Then you get faster, you get more efficient, you get more successful, you get faster, more efficient, you get more successful, you get faster, more efficient, more successful. Then all of a sudden one day you're making some money. Like you're sitting here, are you making any money now? No, it's an investment into the future. You want to make money, cut crowns. I'm serious. No, I'm serious. You want to make money, cut crowns. We know that. Everyone knows that. Who doesn't know that? You want to make also money. You need 6 chairs running simultaneously and hygienists working for you. GPs cannot make money doing fixed ortho. You know that, right? If you don't know that, you should know that. Orthos only make money because they got 6 chairs running simultaneously. And they spend 3 minutes on a patient. And most of it is just chatting with mum. That's the only way to make money in ortho. Terry Rose. In ortho, they say intercanine width change is unstable. Absolutely. And what time do they say from when onwards? From when the canines erupt, that is the finish point of where they're going to be, right? Have permanent canines erupted on a 6-year-old? How many years before permanent canines erupt on a 6-year-old? 10. So if you're working on a 6-year-old, that's stable. Work on an 8-year-old, and you expand, it's stable. When the canines come out at 10, after you've expanded, guess what? That's where it's stable. Did I tell you to go treat a 14-year-old with expansion of the mandible? No, because they'll shoot you down and say, oh, after the canines are up, there's no more expansion. I agree. But I'm telling you to work on a 7-year-old. some schools of thought is that the correct tongue posture is never touching the front teeth on the end spot. It seems your negative pressure seal, the tongue is touching the anterior teeth. So I have high-level peer-reviewed research by real doctors. What do you have? Like, I've got high-level real research done by real surgeons and real specialists of heads of department. What have you got? I'm just following the literature. See, this is how you deal with a question. I'm not making it up. I'm just telling you what I've read in peer-reviewed literature. You just saw the literature. Why are you asking this question? And where's the reference that you've got to show me your truth? Dr. Shah, what can be done around 1 year of age to correct posture? How early have you started GoPex with your patients? 4. What can you do with a 1-year-old? Don't spoon feed them. Yeah. Yeah. There are specialists who deal with little ones. Ask them. Questions from Sydney? Mike?
Microphone, please. We cannot hear. Sorry, still cannot hear.
Yep. Okay. Yep. Yeah. What's your opinion about taping the mouth to overcome the habit?
I want the child to do it.
When they're sleeping? Because, you know, sometimes I do feel that it's a habit they've developed. If we identify it and correct it at the age of 6 or 7,
yeah,
they've been doing it for 6-7 years.
Yeah.
So as much as we give them, you know, we clear the nose and we do everything else beforehand,
yeah,
they've developed the habit of keeping their mouth open. So
Yeah.
in the daytime, you can do the seal the lips, push the chin up, but in their sleep.
yeah. So I'm just talking about research that shows that the body, when a correct swallow in a class 1 occlusion occurs, they get a vacuum seal that seals their lips together, their teeth together, and their tongue against the roof of the mouth, and the soft palate against the back of the tongue, and prevents them from having sleep disorder breathing. So that's how we do it. We create the right space and relationship, and then we teach them to use that space wisely, and they will sleep with their mouth shut. Because that's how we're designed to survive and prosper.
So you're saying doing the exercises and training the tongue to give that vacuum seal
Yes.
that follows through into their sleep,
Yes.
then the lips will automatically seal.
Bite your teeth together. How hard is it for you to part your lips?
Difficult.
If you tape your lips together, does it stop your teeth from separating?
No.
Is that the answer that satisfies you? Because taping the lips does squat other than sealing the lips. Like parents ask me, oh, do you think it's okay to tape the lips? And I look at the kid and said, look, my recommendation is when you start wrapping it around, no more than 3 times around with the gaffer tape. Otherwise, it's dangerous.
Okay.
All right. Have you checked that the nose works? Have you checked that when their mouth is shut, their tongue doesn't jam back against the back of their throat? Have you checked that when they're on their back and their soft palate flops against their adenoids and their nose doesn't work and you've wrapped gaffer tape 3 times around their mouth? What happens then?
Yeah, I'm just basically proposing people who have seen an ENT, done everything else, but habitually just still have their lips apart, because to them that's a natural habit for
Sure.
this.
I'll put them through the rest of my program,
And doing the exercises.
which I will explain in the next section.
Okay, thank you.
So I knew you were going to ask. I knew you were going to ask. And I've got a whole section on it for you. Okay, let's wrap that Q&A up.
Okay, excellent. Just stop that.